Good afternoon. It is great to be back in the city of Boston, and I am so excited to be here with all of you. Thank you for staying. I know this is the last session, so I stand in between you and drinks. You know, I think over the past couple days, watching what's been going on at this meeting over social media has been extremely impressive, because not only have you all put issues like social justice on the map and made it front and center of your meeting, but you've also put topics like fire injury prevention here. And I think this is something that all of us as clinicians, all of us as people who care for injured patients need to think about a little bit more. And I can't really begin talking to you about this topic without telling you my story. I was born just outside our nation's capital in Fairfax, Virginia, the son of immigrant parents that came to this country in search of those hopes and dreams that so many of us strive for. And during my senior year of high school, my life really changed. It was after the first football game of the year, hanging out with some high school friends. And as I turned around, I saw flashes of light. That's what I remember about the moment I was shot. Flashes of light. People running around me screaming, my white shirt covered in blood, my friends frantic, imploring me to lie down. And as I did, I began to choke on blood. Later, I would find out that the .38 caliber bullet that ripped through my throat and injured my carotid artery. And that night, my trauma surgeon was Bob Ahmed, who saved my life by punching a hole in my windpipe. And Dr. Mukherjee, my vascular surgeon, who took a piece of vein from my left leg and patched the hole in my carotid artery. So it's these individuals, along with their teams, that gave me this second chance. Now, I don't know how many of you were at 17, but I think I love this quote by Brad Paisley where he says, at 17, it's hard to see past Friday night. And to me, what that means is at 17, you don't realize that you're mortal. You don't appreciate the people you have in your life. And frankly, most of us, we have no idea what we want to do for the rest of our lives. And that was me. And a few months after my injury, I really came to a different realization. I was standing in the bathroom looking at the mirror. I had a tracheostomy tube. I had these beet red scars up and down my neck. And what I didn't notice was my father was standing at the doorway. And I think he saw the look of despair in my eyes, and he walked in and he said, "Listen, Joe," he said, "what happened to you was terrible, but you have two options. The first is you can feel sorry for yourself, or the second is you can take this terrible incident and try to impact the lives of other people." And so that moment really changed the trajectory of my life. It really inspired me to go into medicine. It inspired me to become a trauma surgeon. And it's what got me to continue thinking, how do we work beyond simply the trauma bay or our operating rooms? And so I wouldn't be here today without these people in my life that have been there through good times and bad. And what was really amazing is that, as you progress throughout your life, sometimes you don't know exactly where you're going. But when you look back every now and then, you realize how all the steps you took got you to where you're at today. And when I finished medical school, I had a chance to go back and train at the hospital where I was a patient at. And not only train there, but train under the surgeons that saved my life. And it was an incredibly rewarding opportunity, but it was also a terrifying one. In fact, sometimes I would be trying so hard and my hand was shaking. They would joke around and say, "Hey, did you take your Parkinson meds today?" So it was one of those moments where it really came full circle. And when I left to go to the University of Pennsylvania, that's when I really then started to understand the aspects of not just caring for the critically injured, but also trying to determine systematic approach to trauma care in this country. And I continued to push myself and say, how do we think beyond these four walls? And so I had spent a year at the Bloomberg School of Public Health, and I love their motto, which says, protecting health, saving lives millions at a time. I think that this motto reflects both the possibility and the responsibility that we have in trying to reduce these public health crises. And for me, that happens to be firearm injury. I think the other thing that we've started to see is that in the latter half of the 20th century, a lot of us in medicine, or at least of the prior generations, maybe some of you, I think somewhat got disengaged from the business aspect of medicine. We got disengaged from the policy aspect. I think it's one of the reasons we're facing such problems with our healthcare system today. And so that really got me to thinking that I need to develop those skills. And I spent a year down the street at the Kennedy School where I tried to develop some of those theoretical aspects. But frankly, I would not be here today without the reflection of so many of my mentors that have really allowed me to maximize my God-given potential. So I just want to say a couple quick things. The first is that I think it's important to recognize our own implicit bias. And as a victim of gun violence, as objective as I try to be about this topic, I recognize that I might not be all the time. The second is I am a board member of the Brady campaign. And the third is I do, like many of you, care for injured patients. So this is a photo from when I was in the fire department. And you know, some of you might look at this photo and say, oh, there's Sakran again, another photo op as the building behind him burns down. But perception is not always reality. So this was a training exercise. And we had just come out of the building as the other team went back in. And I put this up here to make the point that when we're talking about emotionally difficult topics, we really need to hold our judgment. We really need to be able to see all the perspectives. How many times have you been in a meeting and you hear someone that says something that's not correct? What happens when they do that? Well, you stop listening, and we know that 90% of communication is nonverbal, so they stop listening, and communication breaks down not just for that one meeting, but for future interactions, because you remember that's the person that said something I didn't really agree with. So let's really hold our judgment and really understand some of these perspectives. I know a lot of you know these stats, and the deaths that we see on a daily basis is just a small part of this. For every death, there's about 2 to 3 injuries. And that's probably an underestimate because we don't really do a good job of surveilling the non-fatal injuries, which are so important because we know that the recidivism rate is so high in this country. In fact, can be as high as 55%, depending upon where you go. And we know that this affects the population that a lot of you primarily take care of. Some of you might not be surprised to know that 1 out of 3 children have a gun in the home. There are over 300 million firearms in this country. But I think we should all be surprised that nearly 5 million children live in homes with unlocked and loaded weapons. if you talk to any responsible gun owner, they will tell you this is unacceptable. And this is one of the reasons that firearms are the second leading cause of death for American children and teens. A lot of people don't talk about the suicide piece because they say, well, suicide, that's not gun violence. But in fact, I think it is. In fact, suicide is a violent act against one's own self. And it's important because as we think of these different aspects that we're seeing, our intervention is not going to be the same for each of these groups. And when you look at our homicide rate, how you break it up actually makes a difference. So you can see here, this is all ages and gender. Well, what happens when I look at white males? Well, that rate drops. Okay. What happens when I look at young white males? Now that rate has gone up. What about black males? What about young black males? So you can see here that there is a disparity that exists within the population when we're talking about homicides. And in fact, black males are 15 times more likely than white males to be injured in assaults that involve firearms. And we're going to get back to this in a second. I know that what many of us see are these mass shootings, and I know it takes up a lot of the media attention for obvious reasons. We saw it in Charleston, in Sutherland Springs, in Vegas, in Parkland. And when you look at what's happened in 2018, you can see that these numbers are unacceptable. And it's not just these numbers, it's the fact that the frequency of these mass shootings continue to increase as time goes on. One of my colleagues, Dr. Campbell, who works at SFGH, came out after the YouTube shooting. And he was surprised to see that there were a bunch of media standing out there. And he said to them, "Where were you yesterday when 4 African American men came into our trauma center?" The point is that there are young black men that are being killed on the streets of cities like Baltimore, Chicago, Philadelphia, and their stories often go untold. We have a responsibility to tell those stories. We also have a responsibility to demystify the myths that exist. People always say, oh, well, it must be a mental health problem. We know that only 4% of violence is associated with a mental disorder. But what about if you look at suicides? Well, that's a little bit different because we know there is a correlation between suicides and mental health disease. And in fact, we've seen the suicide rate increase since 2007, year after year. Now you might ask, well, why is this so important? For a variety of reasons, but it's also important for us as a community because no one person, no one organization is going to be able to solve this. In fact, when you look at someone that decides to commit suicide, from the time they decide to commit suicide till their first attempt, 70% happen within 1 hour. So that means that after they make that decision, it's too late for us to try to intervene. We have to empower the community to try to figure out those loved ones around us and determine whether or not they're a danger to themselves or others. So when you look at this from a public health perspective and a public policy perspective, it's extremely difficult. Yesterday, before I went into work, I was getting a haircut, and I was looking at the license, and I noticed, I said, oh, look, how many states license professional haircutters? What do you all think? All of them. Yeah, you'd be correct. What about federal dealer license? The disparity is tremendous. So why is it so difficult? Well, gun policy is difficult for a variety of reasons, but there's probably 2 main ones. The first is the structure of our government, but the second is the effectiveness of the gun lobby. And we saw this in 2010 after Citizens United, when there was an influx of campaign spending. And you know what? The reality is this doesn't represent the American people. because the majority of Americans have a lot more in common than they have that's dissimilar. And that's what's sad. And so it's work like this, looking at background checks and other aspects, that make us realize the importance of what we as scientists must do, the importance of research. And I know a lot of you are probably familiar with this, but Art Kellerman published this in the 90s. And this was one of the articles that really got under the skin of the NRA because of the publicity it got. And essentially it said that a firearm in the home is associated with an increased risk of suicide. And so they launched a big public campaign that led to the Dickey Amendment. Now let's dispel one myth here. There's never been a ban on research of firearm injury prevention. If you look at the wording, it simply banned advocating or promoting gun control. And that's important. So then why did the research stop? Well, not only was this amendment introduced, but they stripped the CDC of $2.6 million. Now, do any of you think that's a random number? That's actually the amount that they spent the year prior on firearm injury prevention. So all of this is connected. And when you look at what we are spending on other very rare diseases from a federal dollar perspective, the disparity is tremendous. How many of you in here have seen one of these diseases? I don't see many hands. I know there's a light in my face, but I only see a few hands, right? Not surprising. What about firearms? Take a look at that, right? Everyone now raises their hands. Thank you, Dr. Farmer. So we have to change our approach to this. We have to really start focusing on this like the public health problem that it is. You know, in the 60s and 70s, when people were dying of fatalities, we didn't get rid of cars. We came up with seatbelts and airbags, and we made roads safer. It's that same type of approach that's required, because what we know is focusing on changing human behavior is not cost effective. We have to develop a system that allows us to make it less likely to become injured. And we also have to find our own voice. We have seen that happen over the past couple years. This is a great piece by Dr. Goldberg where she talks about an apolitical profession waking up. We also saw in November what happened in response to the NRA and the fact that we shouldn't be part of this solution. And this was a real eye-opening moment for me, because what I came to realize is that the healthcare professionals really needed a platform to ensure that their voice was heard. And in fact, when we started the handle, initially the first day was like 500 followers, and within a week, that number went up to over 20,000. And this isn't just physicians, this is nurses and researchers, and not just people from within the US, but people outside of the US. And in fact, those were perhaps the most interesting comments, because they said, you know what? We actually don't know what it's like to have to deal with all these injuries. There's other ways to make your voice heard. There's Peter Masiakos and Cornelia Griggs, who wrote this great piece called The Quiet Room in the New England Journal of Medicine, right? There's opportunities to write for Huffington Post and other op-ed pieces. You could do different videos. So there's so many ways. But you know, it wasn't enough just to have our own voice heard. What we had to do is ensure that the voice of the medical communities were heard and were working together. And so in February of this past year, the American College of Surgeons sponsored the first medical summit on firearm injury prevention. And this included APSA. And I'm happy to report that the proceedings are already out. Dr. Bulger and the team did an incredible job of collating all that information, and we were able to get it out in a timely manner. And you can read this, it came out on Monday, but essentially I think it demonstrates a couple important things. And the first is that this is, number one, a public health crisis. And number two, we must work together in order to move the needle forward on this issue. So I just want to end with something that you might find a little bit atypical, and that's telling your story. You know, a lot of us in medicine, we do really great work, research-wise, clinically, but one of the things that we often struggle with is how do we transmit all that information to the public? The data doesn't change the hearts and minds of Americans. If you think it does, I think you're grossly mistaken. The data is important, but it's not enough. And so when you look at people like Marshall Gans from the Kennedy School, who is the world expert on public narrative, he talks about the story of self, the story of us, and the story of now. And essentially he says, listen, when the first century Jerusalem scholar, Rabbi Hillel, was approached by someone, and this person said to them, hey, how do I know what I'm supposed to do in the world? And he said, well, you have to ask yourself 3 questions. The first is, if I'm not for myself, who will be for me? Now, this is not a selfish question. This is a self-regarding question. In other words, if you take on a leadership position, you need to know what they expect from you, and they need to know what they expect. The second is, but when I am for myself, what am I? And I think this highlights the fact that we don't function within just ourselves, our own silos. And we're really an interdependent group of individuals, and we have to function that way in order to be effective. And then the last is, and if not now, when? And I think this just demonstrates that if you have an idea, get it out there, let people vet it. Don't hold on to it for a year. Business folks do this really well, and I think sometimes in medicine we have a hard time doing this. You know, people don't believe in how you do something. Some of you might have seen this great talk by Simon Sinek about the why, the how, and the what. The way you convince people is you get them to believe in what you believe in. The why is so powerful. And that's what allows us to go from value, whatever that value is, to action. You know, since Parkland, there's been over 1,200 kids that have been shot and killed. And I will tell you that I think the young people in this country have really re-energized our nation, and they frankly set an example that we should be setting for them. I'm so tremendously proud of them. You know, we talk about telling your own story, and I'll just tell you that I never realized the power of my own story until I was at Penn. We would bring these underserved kids from the community, and the first time I did this, I give them a tour of the trauma center, then I talked to them about gun violence. And as most teenagers, they were kind of paying attention, but not really. And then I told them my story. And all of a sudden, all of their eyeballs focused on me. It was a reaction that I wasn't expecting, and it was something that really, honestly, frankly, I had never seen before. And so I asked them a question. I said, how many of you in here have personally been affected by gun violence, or your families have been affected? And nearly every one of them raised their hands. So what that moment taught me is that I went from being this person in a white coat to someone that I could actually relate to what these individuals are seeing day in and day out within their own communities. And your story doesn't have to be as dramatic as being shot in the throat. Each and every one of you can have an impact, and in fact, you must have an impact. If you don't tell your story, other people will. And when you look at this graphic, I don't need a caption because they've done such a great job of telling their story. So I leave you with a question. The first is, what's your story, right? You have to figure it out and figure out how to tell it. You know, I love what I do. And I got this in a fortune cookie, and it says, to love what you do and feel that it matters, how could anything be more fun? It's absolutely true. And we do such great work where we save so many lives. This is a great book by Kathy Shore that documents 101 survivors. But the reality is that we don't save everyone. And the worst part of my job is having to tell mothers, fathers, sisters and brothers, that their child that left that morning is never coming home again. I recently had a 17-year-old that was shot in the back of the head, essentially executed. And I had to go up to the ICU, and we have Mark, one of our residents here, he knows how often we do this. I had to go up to the ICU to talk to this kid's mom. And I began telling her about the devastating traumatic brain injury. And she began telling me about her son. She said, you know, he was the first in our family to graduate from high school. He was having aspirations to go to college, just like all of you. None of those dreams will ever get fulfilled. And at that moment, she looked up, and I think she saw the devastation in our eyes. And she did something that I'll never forget. She walked over, and she put her hand on my shoulder, and she said, "Are you okay?" Now just imagine that for 1 second. Here is a mother that just lost her child, and she's asking us if we're okay. It's moments like that which restore my faith in humanity. And it's moments like that which push me to get up day in and day out to try to reduce farm-related injury and death in America. I'm standing here before all of you, but really the people that are doing the important work are my partners back at home, which is taking care of the patients. Thank you all so much for being here and for listening. Thank you.